Oh, welcome back. And I am Dr. Reiner, and this is the second half of the Independent Doctors of Pahrump. And again, if you just tuned in, I do have Kelly Adams with me, the CEO of Desert View Hospital, and we've been talking about healthcare as it is today and what upgrades the hospital has been doing. But we've had Amy on, and Amy still has a question. Amy, go ahead.
Well, I don't have questions so much as I do a compliment for the nurses and technicians and doctors at the ER. Kelly, they were fabulous. I'm not one to rave about a hospital. I avoid them like the plague, but now I really have my confidence built up, and I wouldn't hesitate if I had another emergency to go there. And Dr. Reiner, you're one of the best doctors I've ever had, and I'm very pleased with you.
Well,
and I'll let you guys take it over now. Thank you.
Well, it's good.
Thank you.
I'm happy to hear compliments like that. And she is so on point. No one really wants to go to a hospital, but when you go, you want to know it's a competent facility, a competent organization, that the nurses are trained, that the physicians really know what they're doing.
Right.
You know, I had a mentor many years ago that said, you know, the patient assumes that the MR and the CT are all working well, and all the surgeries are all going well. But really, what they really judge is, you know, was the food hot, was the nurse friendly, and is the TV zapper work?
Yeah.
You know, and those are the three things that are most visible to the patient.
Right.
And those are important. And I'm proud to tell you and our audience tonight that Desert View Hospital scores have risen from probably the 65 all the way up. We're rubbing right up against 90% patient satisfaction now.
That's awesome.
So we're excited to be able to talk about
and I hear that too, and I hear that, and I know I've been there from the inception of the hospital when
you've seen the history.
I've seen the history from the beginning, where you had a struggle going on in the community with the physicians and the ER staff, and the changes in staff that you made. And like I said, bringing you on that's where I've seen the biggest growth and the improvement in the hospital.
Well,
so,
you're very nice for saying that, but
no,
it's what I do. It's what I understand.
Yeah,
so.
and I heard all the background. Oh, Kelly's the hatchet man and all this other stuff. But despite that, whatever that reputation was, the proof has been in the pudding, and that Desert View Hospital has gone from just hovering above to wherever it was to really making an impact. I mean, bringing in the people that you brought in, it's been crucial. So
well, this community was really kind of crying out. And the repeated message, Dr. Reiner, that I heard, as you've heard as well, is we are tired. This is from the patients. We are tired of going to Las Vegas for our health care.
Yep.
And so it made the changes a little bit easier, made bringing in new services a little bit easier. Now there's still a significant amount of work that goes all behind it, and the financing and everything else that goes behind these things, but it makes it a lot easier.
Right.
You know, I'm not competing with a UMC. You know, I'm not competing with another. So we'll do the best we can to keep our costs down, but at the same time, the expectancy of the patient is significantly high.
always high.
Matter of fact, that kind of segues into some things we were talking about a little bit earlier, you know, and that is why is that patient expectation so high? You know, I did my fellowship in the British health system and the Canadian health system, and there the patients both love and hate the system. You know, they love it because it's free, and two, they hate it because of the extremely long wait periods of time. During commercial, Dr. Reiner and I were kibitzing a little bit about the time for a hip replacement or knee replacement in the British health system. And, you know, it could be 24, 36 months. And the hidden cost that is not talked about in the media is the secondary injuries that are caused from the delay of the hip or knee. You know, all of a sudden, you know, because of the bad knee, you know, a back disc has been ruptured.
Right.
And all of a sudden, you know, you've fallen in and you've injured a wrist.
Right.
You know, so there's a lot of secondary type of cost in that system that's really not talked about.
No.
And so the things where we came to here in America is why we're sitting in today's healthcare. Really, you and I have kibitzed a little bit about this in the past. Is it really kind of started back in 1965 when President Johnson signed Title 18 and 19, those Medicare, Medicaid. And for a few years, from 1965 until 1983, healthcare was kind of far, high and wide, to use that expression. Anyone who was 65 years and older, their health care was paid for 100%. And all the hospitals and physicians were on what we called a cost plus. So whatever you did to a patient, you got paid your cost plus a little bit more.
Yeah.
All the hospitals were full. Everybody had an incentive to, to admit a patient.
Yep.
It was a great financial time. And then this is a little known fact that 50% of the hospitals in this country were built between 1965 and 1983.
No, I did not know that. That's a very good fact. Yeah.
I mean, you think about it.
Yeah,
they were so full.
Yeah.
They were so full. We needed additional capacity. The government looked at that in 1983 and said, we made a mistake. We're paying too much for health care. And so they introduced something that has been on the books until, from 1983 until October coming up here, and I'll tell you about that in just a second, called DRGs, Diagnosed Related Groups. And essentially, it affixed a cost, a dollar amount to every known disease.
Right.
Be it surgical, be it medical, be it psychological, there was a dollar amount put to that. And all the insurance companies adopted that same, that rate or near that rate pattern, at least the formula, the template for those types of things. And that drove down costs just for a little bit of a time. But, in 1965, this is unique, the percent of the healthcare as a percent of the gross national product was about 6.5%. In 1983, it rose to about twice, about 12%. And that has continued to rise up and up and up. And when President Obama, then Senator Obama, was looking at healthcare, he goes, we're now nearing 18%. Here's an opportunity. Now, again, remember I spoke about how healthcare has no longer become healthcare, it's become political. Well, this young politician looked at all that, and again, this is factual, this isn't politics. He looked at the rising cost of healthcare and said, I can do something, I can make a difference. Well, he tried to take that curve and drive it down, thus healthcare reform, I can drive it down. Well, what has happened is just the opposite effect has taken place.
Right.
It's actually exacerbated the problem and is moving up a little bit higher.
Right.
So that leads us to the next point that I think is going to be even more costly. The government has come out with a new way to identify an ailment called ICD-10s. And with that, you're familiar with it. It will drive you nuts. You'll pull the rest of your hair out like I have.
Yeah.
And the amount of detail that has to go into a patient bill is astronomical.
Right.
The amount of resources that you and that the hospital has to put in to create a bill, from the physicians, from the billing, from medical records, and from the nursing department, it is phenomenal. Where was the patient position? It goes on and on and on.
And
the cost, the bureaucracy, just to produce a bill to get a little bit less is phenomenal.
Well,
and so
it could be by design to delay billing for a while to scope the numbers, but we can talk about that. We have a caller, Ray. Are you there?
Yeah, I'm here. Well, you thought maybe you're going to get a show without me calling in, Doc, or what? I always call in when I see you live on the air.
Well, thanks for calling.
All right, I got a couple of questions. First of all, Sylvia from California, she used to be a home health care nurse out here, says hi. I just talked to her on the phone, said hi to Dr. Reiner, so I'm doing what I'm doing.
Good, thank you.
Sylvia said hi. Kelly, I'm glad that the hospital is improving, because 38 years ago when I was out here, I was praying for a hospital. Very disappointed when it opened up, and it was like a bus stop. Everybody came there. They were shipped into Vegas in an ambulance, and it just seemed like it was just a waiting room. And I hope that's changing. Listening to the show tonight, I think it is. So if it is so, I congratulate you on your efforts.
Well, thank you. It is changed. And again, as I spoke, I hope you never have to come there, or anybody has to come there. But when you go there, you want to have a place that's very clean, very competent, and all the things we've talked about. Having the throughput and things of today's medicine that it requires of a hospital to be. And, with the new physicians and the new training of the nursing staff and all new leadership there, this small community hospital really is a tremendous organization now.
Yeah, no, I do think that. So,
I was out here years ago, and I used to have to drive her into the Vegas hospitals. It was deplorable, and I said, please, God, send a hospital. Now we got one. It's improving, and so I'm happy for that. I do have a question to Dr. Reiner about valerian root. Now, it seems to have a calming effect. Is there anything wrong with valerian root? And the second thing I want to ask you, whatever happened to shark cartilage? It used to be all the rave, and now I don't hear anything about it. If you could answer those, I'll hang up and let somebody else call it. Thank you very much.
Yeah, valerian root, I think probably has the same thing as Saint, and I'll have to do a little more research on it. But and I may cut you off on the answer because we're going to be going to break here in just a little bit. But as far as valerian root, maybe like St. John wort, may actually have a little bit of serotonin-based thing, which may actually be a mild antidepressant. But I'm going to do a little research on that. And with shark cartilage, I think it's like anything else. It's from the Journal of Irreproducible Results. It hasn't held the test of time. But I will say MSM and glucosamine truly has held the test of time with helping joints and joint tissue. It does trick the synovium into making a more lubricating fluid. So with that short, brief answer, we're going to go to break, and we'll be right back. Thank you for tuning in tonight.